Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, September 5th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In an effort to support healthcare in the Bronx, St. Barnabas Hospital Health System plans a renovation project for its Bronx location. The project will focus on the expansion and modernization of the SBH emergency department to address health disparities and improve patient care and experience. The Senior Executive Vice President and Chief Operating Officer for SBH Health System, Dr. Eric Appelbaum, joined me to discuss these plans. Doctor, thank you so much for joining me.
Thanks for having me.
So can you just tell me about the SBH's latest renovation project?
Sure. We are in the design phase of an emergency department expansion. Our emergency department last expansion was about 20 years ago when I was a junior attending there in the ER. I'm an ER attending by practice, and we've sort of outgrown our space. We probably outgrew our space a long time ago. And the needs for this community are just ever increasing, and we really need to modernize so we can give our staff and our patients a better experience.
No, I think it's just so interesting, especially for me, just as somebody like on the outside looking. I don't think that we often think about like the planning that goes into a hospital, and how we can make sure that patients and people visiting there can kind of like, nobody wants to go to the hospital, right? But
Right.
you want to make sure that while you're there, that it's an experience that you don't think negatively about. So
Absolutely. So, we're looking to address all those needs, right? A hospital, to me, it's like a little city, right? We have to feed people. We have to take care of them. We have to keep them safe. But, while you're there, as a parent, I've been in emergency departments in several places, and you want a really nice experience. You want to have a dignified experience. You want it to be private. Right now, the way our emergency department is set up, it looks more like an open, sort of like a MASH unit. And while the care is great, while my nurses are fantastic and the ancillary staff and the physicians are amazing, it's not a dignified experience at all times. And that's what we're looking to do. You bring your loved ones in, and they're private moments. We have behavioral health challenges, substance abuse challenges. You don't need that advertised to the public, and the public can be right there. So we're really looking to improve that experience so that people want to access healthcare, right? Especially for our young folks. We don't want them to be afraid of physicians. We don't want them to, the physician, from the beginning of time, should be a long time sort of trusted, or the healthcare system should be a trusted area and something that you want to go to. So we got to do our part, especially for the emergency department.
So I kind of want to expand on that. So is the mission to kind of make sure that the emergency department is possibly more private? Is that what you're...
That's definitely one of the, a huge point. Absolute private rooms. Like I said, when I've gone to emergency departments, there are TVs in every room, and we're going to do our best to make it as fancy as possible. Why not? Why not make it fancy? And more private, so that when I'm having a behavioral health discussion with a 17-year-old, young child, about depression or anxiety or about bullying, it's not out in the open, or someone's having one of the worst days of their life, and I have someone who's intoxicated, or someone who has a trauma and is grieving. It doesn't have to be, there's ways to make it better. There's ways for people to look back on that moment and say, hey, there was some dignity there. So that's a key, component of what we're trying to change.
And I could also imagine that it's really important because sometimes that experience makes people not want to go to the hospital because, like, maybe you don't want everybody to know what you're dealing with, or, possible judgment. So I'm really glad that, healthcare professionals are actually thinking about that experience. Now, I also want to talk about that experience and how it's specific to the Bronx, not as specific to the Bronx, but, how it affects people from the Bronx. Can you just talk about some of the disparities, Bronx residents face, when they encounter any emergency room or the hospital in general?
Sure. Well, a lot of our patients are under or non-insured. We have obviously a large migrant population with no insurance, and, the access that they have to primary care is just less. It's just not as good. The hours aren't the same. The ability to connect to physicians is not the same. So they end up choosing the ER as a last resort, right? There's urgent centers that have certainly helped a little bit in some cases, but our folks have to come here out of, almost for things that you and I may not have to go to an emergency department for in the middle of the night. When I was a resident, I used to see young moms bringing 3 kids in the middle of the night. I said, this isn't fair. Why is she doing that? That might be her only choice because she's got to get up and go to work tomorrow and her doctor's not available because there just aren't doctors available. So the disparities of just the access are huge. And then the experience is different. I'm sorry, but when you go into some of the areas across the country where the resources are just much more intense, it's just nicer. It just feels better. Like I said, I'm not, the care is fantastic. We're doing the right thing. Our doctors and nurses know what to do, but it's just that feeling that you get of, that there's someone there for you and can dedicate their time and it's not chaotic. So.
And I'm also glad that you're really here because this is a question that I've asked myself multiple times as somebody who just is from the Bronx and, maybe I'll go to like a healthcare provider. Are the wait times also the same? Because I noticed, at least for like in my community, sometimes if you go to the ER, you're waiting like 8 hours, 9 hours.
Yeah.
Is that like a thing for everybody, or is that specific to areas like the Bronx?
It's going to be higher in low resource areas, right? I mean, we're also going to address things in our community that aren't addressed everywhere. We obviously have a high behavioral health population. Some of those patients may need more resources. We have a trauma center. We're a level 2 trauma center. We're very proud of that, and in some of the areas, and especially in different cities, it's not as high a need. And so when you're essentially in triage, with your cold or flu or whatever we're addressing, or a heart attack, obviously we take right in. But with some of the minor complaints, if a double shooting comes in, and I hate to say that, that does happen, it's going to slow things down. So the wait times, it's a direct result of resources often. And that's something that we're looking, by making the flow of the department and the physical structure enhanced, will improve that. There's no doubt about that. The way we triage people, the way people access the physical department is just going to make things go easier and will improve those times.
Now, how do these obstacles create challenges for healthcare professionals and how they connect with their patients?
That's a fantastic question. So, every year we get young residents and new physicians into the system who are training, and nurses, and that's the first thing that they look around and said, how can I have this conversation? How can I connect to this patient if there's 4 patients right next to me? I'm whispering, and I used to do the chart whisper. Now it's all electronic, but I used to sort of cover the chart and hide and say, hey, tell me about this sort of your XYZ problem. And I'm embarrassed, you're embarrassed. And it's not that I'm embarrassed about the topic. I feel bad. I'm saying this right next to someone. So the connection just isn't there. We see the connection in primary care, right? I also did primary care for many, many years. And the connection I had with those patients, their family, after all these years, you're in the room, and you just get that one-on-one, the eye contact. One of the things that we always teach our physicians is, when you have the opportunity with a patient and you can sit down. You shouldn't be standing, leaning over the bed. Sit down. You're talking. It's person to person, right? They're not patients all the time, right? They're people all the time, actually. So that's something that the staff are really, really excited about, making it a much more, conducive environment for the connection.
And I guess to expand on that, how could, a lot of these upgrades, we talked about a few of them, how can this strengthen that relationship, especially in a community where there's a lot of distrust already?
Yeah. So it just gives you more time. It gives you more privacy to get to the 3rd, 4th, 5th question, right? Remember, as an emergency department, as any healthcare professional in, anywhere, it's not only your responsibility to just address what the emergency is, right? Especially if someone comes in with a sprained ankle and I notice your blood pressure is a little high. I'm going to tell you right now that me taking the extra 5 minutes in a nice quiet environment to talk to you about the dangers of high blood pressure and why you should take your medicine, probably more important than addressing that ankle. And that connection there will lead to better health for that patient and hopefully their family down the road. So yes, that definitely is important.
Now, according to an interview with SBH Physician Magazine, you've been with SBH for over 20 years, which I would say congratulations.
Thank
That's
you.
like a really huge accomplishment. How have you seen the world of healthcare transform, especially in communities like the Bronx?
Well, this is my 26th year at SBH, so sort of born and raised there. I'm not born technically. I was born at Einstein in the Bronx. Spent some time here with my grandparents for many years. I think now we're really starting to address sort of vigorously the social determinants of health. And this is something that was not when I was, a resident and a young physician. We are talking about homelessness. We're talking about the poverty. We're talking about hunger. I mean, we supply food to our patients now. We run a food pantry. We have a teaching kitchen to teach people how to cook culturally appropriate and eat healthy food. We have a gym so people can work out. We have a farm where we're teaching people about how vegetables and healthy plant-based meals may improve their health, will improve their health. So I think that's the big key, is to really focus on the people. And the social determinants are everything now. It's tragic, but because I'm sorry if you live in New York City in certain zip codes and then you just take a train ride up, your life expectancy goes down just based on where you are. And that's something that in today's day and age just shouldn't exist. And it does, and we're doing our part to face it.
Now, I guess for the overview, can you just explain, what the expansion plan is? We talked a little bit about that, but can you just give us like an overview of like what the plan is?
Sure. So the plan is to completely modernize the ED. So we plan to add tons of private rooms, improve the access for the ambulances, a dedicated behavioral health unit that's, a dedicated pediatric unit, geriatric unit, upgrade a lot of the staff workstations. So there's a whole suite of options that we have there, but we're really looking to address what the Bronx needs, right? So I want to improve my trauma access. I want to improve behavioral health. I want to improve the experience for substance abuse patients, and then pediatrics. Definitely, when kids have to come to the ED, we need to have a dedicated space. And unfortunately, over the years, we've had time where we sort of had to just move people around. And that's just, it's not good for the staff. It's not good for the patients. So we're really looking to improve all that with this project. And it's very exciting.
And I'm excited just hearing about it, because I think that it's important for people to understand that like these things are being looked at. Like I said, sometimes I'll go and I'll be like, this should really be fixed. Like thing shouldn't be this way. So it's so glad to hear that, that your team is actually thinking about that and working on it. So I appreciate, you taking the time to talk to us about this.
Thank you so much. Well, we're looking for support, obviously from our community, our elected officials, and, we hope we can get this done. And, I appreciate the time to talk today. Thank you so much.
Thank you. If you want to stay up to date about SBH's plans to expand their space, please go to their website at www.sbhny.org or follow them on social media at SBH Bronx. Stick around. We'll be back with more Open right after this.